Let's talk about the importance of prenatal and what is the role of the PT in that process?
So I look, a lot of times we have issues that are underlying issues that when we're pregnant become more manifested because our body can't compensate as well. So what does that look like? Back pain, hip pain. I see some like SI dysfunction, pubic symphysis pain. So anything around that pelvis, knee issues, foot issues. We've got this kinetic chain that is now constantly changing with pregnancy. That is not all hormonal related. A lot of it's physiological, where we have a lot more control. There's a lot of research coming out on relaxin and how its role isn't as large as what we thought. What does that do? It puts the power back in our laps as therapists and as patients to say, look, if this is out of whack or unaligned or whatever the common term is that you kind of believe, let's get this turned back on, let's get these muscles firing like they're supposed to. And in turn, that reduces the pain so that you can enjoy the rest of the pregnancy, without having issues. So I see a lot of that alignment work, and I see a lot of the core just gets turned off. So like the transverse abdominis, the abdominal muscles, the diaphragm, the pelvic floor, everything gets kind of out of sync because we have some baby growing that changes our dimensions, that changes our base of support and our center of gravity, and learning how to move with our new body during pregnancy is important. And most of us, myself included, work up until the day of delivery. So we're demanding our body to do these higher level tasks, or we're still in the gym, which is great. Sometimes pain doesn't allow that, and that's where I'd love to be able to step in and offer a set of hands and then the education that you just need to get some of those muscles woke back up, as we say, and retrain some of those things to be reciprocal again, to just work how they're, or reflexive, to work how they're supposed to.
What is the caution, or is there specific movements and that we have to avoid during this period? Because people sometimes are afraid of doing anything, of exercising. They feel that's not safe. So what do you think that changes during that period? Like, is it important to look for someone that is qualified? What are the precautions we have to take during this period in regards to the exercises and the preparation?
So we know that exercise reduces the chance, this is all research-based, exercise reduces the need for C-sections, exercise improves cardiovascular health throughout. We know that we recover better postpartum. So we watch, let's see, the symptoms that I kind of watch for, or if you're exercising or with a clinician, whether it's a chiro or a PT or a massage, or is looking for those pelvic floor symptoms. So are you feeling heaviness when you're doing an exercise or movement in the pelvic floor or belly? Do you have pain anywhere between rib cage and knees, or really anywhere in the body? Is there doming or coning? So when you look at the middle of the belly, we have the linea alba. It just connects our right abdominal muscles to the left. And naturally, 100% of us have a diastasis, have that separation during pregnancy. That's normal. We want that because our belly accommodates for baby. What we don't want is to continually load that abdominal wall in excess that can further stretch that prematurely and create more of a thinning there. So that's probably one of the biggest precautions. There's not a ton of literature on like laying flat on your back. We'll go symptom-based because that used to be do not put the patient supine or do not put them on their back because of the fear that the belly, the pressure of the baby, the fetus will interrupt the blood flow. So some people kind of go by they're more cautious, 20, 30 weeks, let's put them at a little bit more incline. But until that patient is super, I want to say super symptomatic, but until they have symptoms, there's no reason to not. And then if they do, you just get them off of that position.